All of the inpatient rehabilitation programs are CARF accredited. CARF is the Commission on Accreditation of Rehabilitation Facilities. We are also the only CARF specialty accredited stroke rehabilitation program in the state of Connecticut. Our stroke program is by far the largest inpatient rehabilitation program. If you combine our stroke program and our brain injury program, that accounts for about 2/3 of our inpatient rehab population. So we have a lot of experience dealing with this patient population. We are also a Joint Commission accredited, which assures that our programs are meeting the standards for the care of our patient populations.
At Gaylord, we have a very aggressive therapy program specifically for patients after they've had a brain injury or stroke. The patient is the main player on a team. We think about the patient and their needs first. Other players along the team include the medical doctors, their physician's assistants, all of their therapists, psychology, and together as a team we come up with an active therapy plan. The therapy plan allows the patient to work towards goals to make them safer and more proficient to get either home or to their next level of care. We cater all of the therapy to what the patient truly needs. These therapists work with the patients both in individual sessions and in group settings. Sometimes the patient may work in a smaller satellite gym that may be quiet and calm, and we also have a larger gym where patients may be working among other people where it's very hustle and bustle. We have an aquatic therapy pool with trained aquatic therapists that allow the patient to work on things such as relearning to walk, balance, stretch, and strengthen their body. Therapy not only happens within the facility, but we have gorgeous acres of grounds where patients will take advantage of a putting green, golf course where they can play archery, and the patients have the unique opportunity where they can go on community reentry trips. What that is a patient will go on a trip along with a therapist to areas around the community, such as a restaurant or a grocery store, so they feel that much more comfortable when they go home.
All of our patients are followed by physiatrists, hospitalists, potentially mid-level providers such as physician's assistants and advanced practicing nurses, as well as rehabilitation nurse specialists.
As a nurse manager, I'm responsible for the nursing staff as well as the certified nursing assistants, as well as a 37-bed unit. On the unit, we have several RNs and CNAs that run on each division. We have 24-hour coverage of CRRN, which is Certified Registered Rehab Nurses, and what that entails is going in front of a board certified to take 150 question tests to be rehab certified. We have about 20 currently on staff today, and it just kind of steps up the notch regarding rehab division and having that added care. And they oversee our RNs and nursing assistants and mobility techs. We do have ACLS or advanced cardiac life support nurses on staff 24 hours a day as well.
Physiatrists are specialists in physical medicine and rehabilitation. The field of physiatry works with patients with various kinds of disabilities and functional deficits, and it's a very team-oriented medical specialty. For our inpatient rehabilitation patients, our physiatrists can see them both as inpatients as well as follow them as outpatient to continue following their functional changes over the course of time and achieving a good continuum of care.
The registered nurses work quite closely with the therapists on staff. Each week we meet with the team leader of therapy services. We also meet along with the care management and medical division, and we all discuss the patient's progress in each area and determine their length of stay and determine what their outcomes may be down the road regarding discharge.
The physician is always the team leader for rehabilitation patients, and all of the subspecialties work together to collaborate and assure the best outcomes for our patients.
Gaylord is also known for having state-of-the-art technological equipment. We have the exoskeleton. Ekso is a wearable bionic suit that can help patients after stroke relearn how to walk. And another common piece of technology that people are already familiar with are iPads. We have those available for patients as well. Not only can they learn how to communicate with their loved ones, but also we are specialized in making sure that we pair them with apps that help challenge their cognition. Here at Gaylord, we also offer the Stroke Education Series. It's available not just to the patient, but also their family. It's a weekly lecture series led by therapists. The therapists have the unique ability to talk about what to expect in therapy, but more importantly, what to expect for after when they return home and prevention after stroke. The therapy team is responsible for ordering any needed medical equipment for a safe discharge to home, whether it be a hospital bed, a wheelchair, a walker, a seat for the shower. That's something that the therapy team is responsible for, not only training the family with how to set up and utilize with the patient, but also for ordering. We also have a peer mentor program where patients after having a brain injury can meet up with someone in the community that has already gone through the recovery process.
Amongst the potential continuum of care for our acquired brain injury patients, we have both inpatient as well as outpatient services, and we also have transitional living opportunities, which is the only transitional living house in the state of Connecticut.
So this is Galia Hamcourt. She is our working facility dog here at Gaylord Hospital. She visits patients in the rehab division. She currently is able to co-treat with our therapist. We can throw the ball for her. We can have patients walking between cones for balance. She can also open up doors, turn light switches on and off, motivate patients to get out of bed. We've used her in a multitude of different things with the spinal cord stroke and brain injury unit. Recently, Galia had a patient that refused to get out of bed, so we used Galia to motivate her and get her shoes and socks to bring her to the bedside and encouraged them to walk Galia to therapy, and it worked really great for that patient. We've also had other patients just request a visit for when they're down, just to take them out of the hospital for just a few minutes. Since Galia's been at Gaylord Hospital, she's been an asset to the rehab division, helping not only the patients, but I think the staff and visitors love her just as much. Gaylord's been providing care for over 100 years. I would recommend Gaylord for your rehab needs. If you're unable to visit Gaylord, please visit our website to view our outcomes and patient satisfaction.
We have a very, very high patient satisfaction. We are surrounded by a beautiful environment, and we all work together to achieve successes with our patients.
Because of our innovative technology and caring and knowledgeable staff, Gaylord is the best place to get the best outcomes after having either a stroke or brain injury.